I want to show you a little video. Remember that viral video? This was the NHS clap. This was Britain celebrating its healthcare workers for their service during the peak of the COVID pandemic, for fighting COVID-19 from the front line.
What do we want?
Fair pay!
When do we want it?
Now!
What do we want?
Fair pay!
How do we get it?
Strike!
I don't know, but I've been told
I don't know, but I've been told.
our government is mighty cold.
And those are videos from the present moment. The same healthcare workers are now on the street protesting. Very recently, Britain saw the largest ever NHS strike.
Just listen. They're still not listening. They're still saying, you know, the NHS doesn't have the money to pay. Of course the NHS doesn't have the money. That's why we're here. We're here for everyone.
There is a crisis in Britain's healthcare system. The NHS seems to be on the verge of collapse. Some would say it has already collapsed. The hospitals are full. There's a shortage of ambulances. There's a shortage of staff. The NHS is stretched for budget. Nurses are out on the streets protesting, and patients are waiting hours, weeks, months, years sometimes for treatment. How did the NHS get here? Let's just start with some history, though. What was once a really well-reputed organization. The NHS, of course, was created after World War II. The idea was to provide free healthcare to war-stricken Britain. So the government took over every hospital. They were all nationalized, which means that Britons could just walk into a hospital with a health problem, come out totally cured without having to spend a penny. Sounded great. And it did not take too long for the NHS to become Britain's pride. Today, it's the world's largest government-run healthcare service. It is also Europe's largest employer. NHS employs upward of 1.2 million staffers, and that service runs on tax money. It is also considered one of the leanest healthcare services in the world. All of those laurels. It was the pride of Britain, and yet the NHS is suffering today. The obvious question is, why? Well, partly because of money, the root cause of so many problems in this world. You see, something happened in 2010. The British government began restraining the NHS budget. The idea was to make the NHS focus more on efficiency. But reports say that departments ended up competing for funds and many had to cut ends. Reports also say that some departments had to compromise then on recruitment and on training. Salaries also took a hit. The paychecks did not increase with inflation, so doctors and nurses became unhappy. And then came the pandemic. The once-in-a-century mayhem curing COVID-19 patients became the priority for the NHS, and rightly so. There was no choice. It just had to be done. The healthcare system then began slowly focusing on COVID vaccination, and this meant that all non-COVID cases had to be delayed. Those coming in with non-critical or non-urgent problems were asked to wait. Today, that backlog has come back to haunt the NHS. As we speak, at least 400,000 people are waiting for treatment. Before the pandemic, that number was just a little over 1,500. And then came the winters. Flu cases went up. The elderly began falling sick more than usual, as did children. Hospitals began filling up faster than usual. Beds were occupied more than usual. And the result has been fatal. NHS data shows that half the patients in the emergency ward have to wait for 4 hours or more before a doctor can attend them. 4 hours or more in an emergency room. Half an hour in an emergency case, sometimes 5 minutes in an emergency case, can become a matter of life and death. So imagine what happens if you're having to wait for 4 hours for emergency help. A medical journal called the BMJ carried out a study in 2022. It found that for every 82 patients forced to wait more than 4 hours for emergency care, 1 additional person died. This was an avoidable death. The data also shows that getting a bed in Britain's government hospitals can take up to 4 hours. And the horror cases are piling up. Last year, an Indian origin IT worker named Akshay Patel lost his mother to NHS delay. Patel's mother had developed a breathing problem. He called 999. He called 999 5 times. The local hospital was just a 2 minutes drive away. So the ambulance handler on the phone told Patel that the ambulance would be there soon. But the paramedics arrived an hour later. By then, Patel's mother had died. So whom do you blame? The NHS is stretched for resources and staff. Many are burnt out and are exiting. They're quitting their jobs. All of that courtesy both the pandemic and the present crisis. UK government data shows there were 133,000 staff vacancies in the NHS in September 2022, as compared to 83,000 before the pandemic. So it's not surprising that the doctor-patient ratio has gone up now. The average family doctor in the UK is now looking after 2,300 patients on the average. In 2018, that number was 2,100. There is another problem that is contributing to attrition in the NHS: salaries. Ask yourself this: would you work for a low-paying job with so much stress and so much pressure? NHS workers are no exception. The average pay at the NHS has fallen. It has fallen by more than a third since 2008. This, of course, if you adjust for inflation. And the result is before your eyes. The number of doctors who are retiring early has tripled in the last 13 years, from mid-2021 to mid-2022. More than 34,000 nurses have left the NHS. That number is up 25% year on year. There are now more than 47,000 nurse positions lying vacant at the NHS, which, by the way, is almost 12% of the total nursing workforce. Today, 7 in 10 people in Britain say that the NHS service is bad. What about the remaining 3? What do they have to say? And what do the experts have to say? Let's now try and get in some of them. Let's get in Christina Paget, who's a professor of operational research within healthcare at the University College in London. Professor, welcome to the show. Let me just start by asking you your analysis of the latest situation at the NHS.
So we had the worst winter on record, but that is now getting better. So we're seeing like the flu wave has ended, the other respiratory viruses have ended. So there's much less pressure that way. Ambulance response times are coming down. Hospitals aren't quite as busy anymore. So it looks like the worst is over for this year.
Based on whatever research you're doing, how long do you think the waits really are for medical treatment? How long are the waits for crucial emergency care, for example?
Well, it depends which type. Emergency treatment waits have come back down. They're still not where they should be. They're still several hours, but they're not, 10, 12 hours, which they were. We do have a record 7 million people waiting for routine treatment. That's, almost 8% of our entire population. And that backlog is going to take years to clear. And I think people are quite clear that that is a really long-term issue that we have to deal with.
Okay, look, so let me just ask you that directly. What happens if someone has a genuine emergency? Someone's having a heart attack, someone's having a stroke. It's a genuine emergency. What happens in a situation like that?
So right now, it's pretty much back to normal. So, you'll call an ambulance, the ambulance will come and you'll go to hospital. In December, it was really bad and basically you might have to wait several hours for an ambulance and then wait several hours outside the hospital in the ambulance and then wait several hours in the hospital before a bed became free. And that was basically quite disastrous. And there's this group called the COVID Actuaries Group here, and they analyse the data and they think an extra 500 people a week died because of emergency delays in December.
Thank you, Professor. Thank you so much for joining us with that perspective. So you see, the fact remains that today, many Britons are going to private hospitals and clinics instead of a government hospital. Estimates say that there's been a 184% jump in the number of people going to private clinics for hip replacement, for example. 153% increase in the case of knee replacement. 42% for cataract surgery. And look at what the NHS data shows. It will take 2 years to clear the backlog of cases. How can a healthcare system go on like this? Where does the NHS go from here? And what are the sustainable solutions to all of this? Let's ask these questions to Professor Waham Hanif, who's the head of service at diabetes at the University Hospital in Birmingham. Dr. Hanif, thank you so much for joining us on the show. Just trying to understand how bad the situation really is, because even looking at it from countries like India or anywhere else, when you see what's happening in the UK, it sounds somewhat scary. Long queues, people waiting for treatment for days or weeks together. Months ago, it wasn't this critical, but today, the headlines are sounding really scary.
Well, thank you very much, Vikram, for having me on your program and to talk about the NHS. Yes, I think NHS has been in crisis. So I've been working in the NHS for more than 2.5 to 3 decades, and the situation has not been as bad as it is now. And the reason for this is, if we need to really understand the reason why the NHS is not functioning as good as it should, we have to go back and dig quite deep into what the issues are. Because the issues are a bit complex and we will try and explore it. But the situation, you're right, is not good. We coped reasonably well during the pandemic, and this is the effect of the pandemic and some of the structural issues in the NHS, along with the changing population demographics, which have not been addressed for far too long.
But Dr. Hanif, I have to say, when you're talking about 12-14% of GDP being spent on healthcare, that sounds actually excellent. I mean, look at a country like India, for example. I think that figure is something like 2.2% or something like that, which obviously is somewhat low. So is the solution just in spending more money, or is it also in changing the structure in some way?
I think this is a big issue, and this is the big debate in the UK at the moment. So one is, I think it probably requires both. The first thing is, if you look at the Nordic countries or Northern European countries who spend a huge amount of money and their taxation levels are very high, but that is what the countries have committed themselves. But these are small populations. In the UK, currently, the taxation is very high, perhaps one of the highest in the world. And the population is not willing to have more taxation. The second issue, which is again very important, is the UK as a population believes in the NHS. So NHS is something very holy to the UK population. So they don't want anything to be done to the NHS. Now, in terms of funding, yes, more funding is required, and there is no other solution than that. And the reason for that is that as the healthcare is getting involved, the healthcare is becoming more expensive. Therefore, you will need the funding. But just the funding will not solve it. NHS needs some real big structural reforms. These are the reforms, things like use of new technology. NHS still lags behind, even countries like India, when it comes to use of digital technology in terms of accessing healthcare, and that is because of data protection and lots of other things. So that is, again, a big thing that UK needs to do.
Okay, so last question, looking at it from the point of view of countries like India, for more elective procedures, if you've got to get a knee replacement done or a bunch of MRIs or tests of some matter, something which is elective, do you think a lot of people will start saying, okay, look, plan B, let's not try and get this done in the UK, let's actually fly to a country like India, and it may well be easier and cheaper to just get it done there. We may have to pay a small amount for it, but it's better than waiting for 6 months or for a year.
Yeah, no, I think this is something that we are worried about, because a lot of my work has been around the health inequalities and a lot of patients who can actually afford to have things done. Because the NHS, you've got to understand that the guiding principle of NHS is free healthcare. It doesn't matter what you need, a heart transplant to a simple paracetamol, everything is free. So people who can afford it are able to get these treatments done privately in the UK as well, because there is a private healthcare system where a lot of elective work is done. NHS has started utilizing that capacity for these patients. So some of the patients who can afford it are also going back, because in countries like India, the treatments are very cost effective or cheap when you compare to what they have to pay privately. Right. But a large chunk of the population who cannot afford it are not able to get these elective procedures done. And the reason for that is that this is something when I talk about structural reform. So the way the NHS has been set up is a single hospital that provides acute care and elective care, which means that if you have a lot of acutely unwell patients who cannot be discharged, they start occupying surgical beds. And therefore, elective work stops. Now, that is where there has to be a separation where acute care is provided in a different setting and elective care is perhaps provided in a different setting. And these are the various models that are being looked into.
All right, Dr. Harif, thank you so much for joining us and sharing that perspective on what seems to be an alarming situation for healthcare in Britain right now.